Okay, we're going to get started here. Welcome to the Facebook Live event with me, Representative Rick Larsen, and we have two guests today, Mayor Laurie Gere of the great city of Anacortes. Thanks for joining us, Mayor. And Polly Dubbel. Is it Dubbel? Is it Dubbel? Polly, how should I say it? It's
Dubbel.
Dubbel. I got it both wrong. Sorry about that. Polly Dubbel, who's with the Skagit County government in their health department. And I'm going to turn to them in a moment. But today we're going to be talking about the American Rescue Plan, which is we passed a few weeks back. And Mayor Gere is going to talk a little bit about what it means for the city of Anacortes. And then I'm going to turn to Polly, and we'll talk a little bit about vaccinations in Skagit County and what the ARP means for Skagit County, but also what are the next steps for vaccinations and testing. So thanks again, everyone, for tuning in worldwide here on Facebook Live for this event. I'm really pleased to have our guests today, and I'll turn to them in a moment. I want to cover for everyone the some elements of the American Rescue Plan. It's pretty clear that the economy is starting in recovery, but we also know that our neighbors here in Washington State are still hurting from the pandemic. So the American Rescue Plan, if you wanted to sum it all up, it's going to put shots in people's arms, it's going to put money in people's pockets, it's going to help our schools reopen safely and put kids in schools, and put people back to work. Now, what's all that mean? Well, it means this. Getting shots in arms. Certainly the issue I hear most about is, when can I get a vaccination? Why am I not vaccinated? Why is that other person getting vaccinated? I'm not getting vaccinated. Well, we're going to hear a little bit about from Polly how that process works, but also what is being done to answer those questions. So just 2 months ago, on January 27th, fewer than 11,000 people in Skagit County alone had received the COVID-19 vaccine. Last month, I sent a letter to the Biden administration to address some of these vaccine distribution challenges that we had in Skagit County and across my district. But thanks to the American Rescue Plan and the President's executive actions and the hard work of health professionals like Polly, more vaccine shots are getting in arms. And so far, sounds like, well, I don't know what the exact number is, but Polly can cover for us. I think she said that 29% of people in Skagit County have at least one shot. So that's very exciting, and we'll see what's going to happen next to increase that. But the public health response is going to lead economic recovery. There's no shortcut here. And the American Rescue Plan provides more than $20 billion to establish a national vaccination program to deliver vaccines faster to states. That includes testing, contact tracing, addressing shortages of personal protective equipment, treatments, and addressing healthcare disparities. The plan puts money in people's pockets, and 80% of all adults and 77% of all children in our state will receive an EIP. You maybe know them as the relief checks. The technical name is the Economic Impact Payments, EIPs. And this time around, we include checks for mixed status households and for adult dependents. So think of a college student who's 19 years old, still a dependent, but is an adult under the law. Under the CARES Act, that person didn't get a relief check, but I can speak from experience. College students need all the help they can get financially, and so they're getting getting the EIPs. This American Rescue Plan has $1,400 checks going out on top of the $600 that was passed at the end of last year for that, fulfilling that promise of $2,000. And we're extending federal unemployment benefits for tens of thousands of Washingtonians that will pay the bills and to keep food on the table, with an additional $300 a week benefit, federal benefit, that was extended through September 6th of this year. To check the status on your payment, the number one question I get about payments is, where's my payment? First, before you call my office, which you can, but before you do, check the IRS website, irs.gov. And right there on the first page is the check my payment icon, and you can go there. So check that first. School districts, we're helping them reopen safely. There was $128.5 billion for school districts to help schools open safely so they can move to hybrid learning. We're moving towards a lot of hybrid learning in school districts in our state. And I know in our state as well, school districts have to offer hybrid learning by the end of April. Give you an example of what school district funding means. Anacortes School District, Mayor Gere is going to get about $2.1 million to help them with costs. Burlington Edison, about $5.7 million. LaConner, $687,000, and Cedar Woolley, $4.6 million to the school districts to help them reopen safely. That'll be for PPE. It might be to pay school bus drivers. It could be for hotspots. One thing that we are doing is allowing more flexibility for these dollars in school districts. So some of the school districts may choose to use this money to hire mental health counselors to help students who've been under this pandemic under a tremendous amount of stress and strain. And we've heard that call out from students, the need for more health counseling because of the pandemic. And then I'll just note on putting people back to work. State, local, and tribal and territorial governments have been on the front lines of pandemic response, and Mayor Gere is going to talk a little bit about the work in Anacortes. Preliminary estimates in Skagit County are that the Skagit County government through the ARP will get about $25 million. And the city of Anacortes, Mayor Gere, and she knows this, I'm sure, nearly $2.9 million for the city of Anacortes. Look, cities and counties, they need to build back the services that we've all taken for granted. With these dollars, they'll have about 3 years to help slowly build back the services as the economy recovers. And we'll hear a little bit about that. I'll just make a personal note about an issue I worked on because we have a very large aerospace manufacturing base in the state. We have over 1,500 aerospace companies that supply parts and components to Boeing and Airbus and Cessna and Gulfstream and the like. But those supply chain workers have been forgotten, and some of those folks have been laid off or have threatened to lay off. So there is the bill, the Aviation Jobs Manufacturing Protection Act, was incorporated into the ARP. That's my bill, is a bipartisan bill. Bipartisanship does in fact exist in Washington, D.C. The bipartisan bill put into the ARP to help these businesses keep women and men on the job or to bring them back to work to relieve some of that cost and to help pay those salaries. So they can start building the parts and components that need to go into airplanes that are going to get bought by the airlines as the airline travel returns, which if you look at recent TSA numbers, it is returning. And so we're trying to make that easier for that part of our local economy to come back. We continue to a variety of other things as well, but that's a lot of info for you all, but there's still a long way to go. Help is on the way for Anacortes and for Skagit County and for Northwest Washington. And with that as a matter of introduction, I want to now introduce everyone to Mayor Laurie Gere, who's the two-term mayor of the city of Anacortes, and announced earlier this year that she will not be running for re-election. And so, Mayor, before I turn it over to you to talk about Anacortes, I want to thank you for your continued service to the city of Anacortes. You've been a great mayor, a great partner to work with on a variety of issues. And I'm not saying that we're done because we've still got a whole rest of the year to work together, and I'm looking forward to that as well. But thank you for your service, and I'll turn it over to you, Mayor Gere.
Thank you, Congressman Larsen. Thanks for spending this time with us today. And as Rick mentioned, the American Rescue Act will be incredible help to the city of Anacortes. Over the last year, we've lost revenue due to lack of sales tax. We have people in arrears on utilities. Families and businesses will be able to help them. We have also seen, what the reopen, like you said, just putting money in families' pockets and getting our schools reopened are probably two of the most important things this act will do for our community. We at the city, though, will help the community with getting caught up with their utility bills. We will help with housing. We work very closely with Anacortes Family Center. And one thing that's become very dire during COVID is people being able to keep up with their rent. And now affordable housing is even more, almost gotten to be a dire situation here. So we'll spend a lot of money in that regard. We'll continue to support our small businesses in any way we can. We also are putting money towards reopening our senior center. We closed our senior center a year ago, and now we have the startup costs, and I think the need is even greater than it's ever been. So we're gonna, look at that as we reopen this late spring, early summer, bringing services back to our senior center. We'll continue to fund all the virtual programs that we've learned to fund and participate with over COVID, whether it's through the library, through Park and Rec, through all services in the community. And then remote work. We at the city have continued to have to put money into our IT infrastructure because we have found about a third of our workforce now works remotely, and some of that may come back and some of that may continue. So we will continue to put funding into the city for that. We've also lost a lot of income, and I talked about that. And then taking care of our first responders, continuing to do the work that they support them with. They did over 12,000 calls last year between police and fire, and taking care of them. And we also have equipment that wasn't bought last year and needs to be bought. So we're looking at, we need a new ladder truck, we need a new ambulance. So there's all kinds of things because of lost revenue that this will help with. So thank you. We're really appreciative of this, our whole community, because COVID has had devastating effects on our community, as it has every community.
Yeah, well, thanks for sharing that. I think it's important to hear this, that some people have said, well, this is just the American Rescue Plan is only a little bit that's for COVID. It's like, well, if a small business closed down because no one could go because of COVID-19, yeah, you could say if the small business owner didn't see himself, herself have COVID-19, but clearly that's an impact of COVID-19.
Absolutely.
That's an impact. There's no question about it. If the senior center in Anacortes shuts down, ask the seniors if that's not an impact from COVID-19. So I think it's important that, these services that we take for granted at times, it's important that we hear kind of why they went away and the things you're doing to bring them back. So really appreciate that. Polly, I want to turn to you and give you the floor for a few minutes, and let's talk about the public health response in Skagit County. What's the current status? Oh, hit that mute button. Sorry.
Thank you, Representative Larsen. I appreciate the opportunity to be here with you today. So our COVID-19 overall response is still in full swing. We are still operating under Skagit County Unified Command. So I am the Communicable Disease Manager, and I'm also the Health Branch Lead for Skagit County's COVID-19 response. Currently, we do still have cases. They're at a much lower rate, and we're really happy to see that, but we still do have some serious impacts. We still do have people, far fewer, but people having to go to the hospital. We still do have people who die of COVID, which is very, very unfortunate. So we continue to run our disease investigation team 7 days a week from public health. The other major effort we have underway right now is vaccination of our community. So we have many key vaccinating partners in Skagit County, and in Anacortes in particular. We have Island Hospital, we have Safeway Pharmacy, we have Walgreens pharmacies coming on board now. The pharmacies, many of them are receiving vaccine directly from the federal government, which is wonderful and very helpful. Island Hospital, the other hospitals in the county and the clinics and public health receive vaccine through the state allocation program. The other key partner I want to point out near Anacortes is the Snohomish tribe is doing a very good job of getting vaccine to people within their tribal boundaries that they serve. And we have some private pharmacies like Laconner Drug vaccinating folks also. So we really appreciate all our vaccinating partners. Skagit County Public Health is also a vaccine provider, and we have multiple efforts going on. We have our Skagit County Fairgrounds is a pretty high volume vaccine site. We have the potential to vaccinate 4,000 to 4,500 people at that site per week if we are running both dose 1 and dose 2 clinics at the same time, and we have the full allocation of vaccine that we can run through there. We and most of our providers aren't running with the full capacity that we're able to, just because vaccine is still, we haven't reached the full allocation flow that we expect to come probably sometime in the next month. So when Johnson & Johnson becomes more available, we expect that all of our providers in Skagit County will be able to operate more at full vaccine capacity. We also are assuring equitable access to vaccine. For instance, today we have a clinic at LaVenture Middle School partnering with a migrant outreach team from Mount Vernon School District to provide access to migrant families who meet the phase 1B, tier 2, 4 category. We also have done a number of mobile clinics to assure that our seniors that are in congregate housing settings have access to vaccine. We have some evening clinics coming up at the fairgrounds targeted at farm workers, and we continue to provide some mobile clinics to concentrated work environments, such as agricultural processing sites. So those efforts will continue through the coming weeks, and we will also start to partner with Mount Vernon Fire and perhaps other fire EMS departments to get vaccine to homebound folks. So that's coming on board in the next few weeks as well.
Holly, before we went live, you said that 29% of people in Skagit County had at least one shot. What does that absolute number turn into? What's 29% mean?
Gosh, the state is not showing me that absolute number. So someone quick do the math. 29% of, it depends on which number you take as our county population. We're usually using 129,000 as our estimated current population. So
about 36,000 people.
Yeah, it's a pretty significant number, and we really are excited to see that number go up week by week. We really appreciate people being excited about getting vaccinated, getting out as soon as they can, as soon as they can get an appointment, and just look forward to that number going up every week.
Okay, great. Hey, I'm going to ask some more questions, but before we do, I've got my Facebook Live public service announcements. The first one is this. This week marked the 11th anniversary of the Affordable Care Act becoming law, which opened the door to quality, affordable health care to Washingtonians, including those with pre-existing conditions. So last year, more than 2 million Washingtonians accessed health coverage through Washington State's Health Benefit Exchange. The Biden administration recently extended a special open enrollment period through August 15th. So you can go to Washington Health Plan Finder, its website at washingtonhealthplanfinder.org to request assistance from trained navigators and to sign up for health plans for 2021. And I know that 200,000 people already this year have signed up through the special enrollment period. So main point here, special enrollment is open through August 15th. And I've got some things on the big board in the back here. I don't know if you see them. But yeah, the one maybe folks at home use your binoculars to read that. Again, it's wahealthplanfinder.org for the Washington Health Plan Finder to sign up for healthcare. Also, we've got Skagit County's www.skagitcounty.net website for some of the community health and public health actions that Holly talked about. And the city of Anacortes is at anacorteswa.gov. And then you Laurie, you've got a COVID-19 page there on the city's website as well. And then I'm up there too, but you can always get a hold of me. So just some questions to get us started. Paul, I wanted to start with you. So we're in the middle, we're near the end of March, going into April, and by May 1st, the president said there'll be enough vaccines kind of in the pipeline for every eligible person 16 and over to kind of, every person 16 and over to become eligible. How are you planning for that? It seems like if we're moving from all these crazy tier 1, 9B, 4, 6, 5, subset A, to basically, if you're 16 and over, go. How are you planning for that demand, and will the supply be there, or are we going to have this supply demand curve not meeting again? How are you guys thinking about this?
So we have been planning for full capacity, and we can, we with our vaccinating partners can increase our current capacity because we just simply don't have enough vaccine right now for all of us to run at our full capacity. So we think we will be fine when we're ready for the vaccine flow to increase. And we look forward to being able to vaccinate a few thousand people more each week in Skagit County. I think we and all our providers are ready for that. So the vaccine availability, we anticipate based on information from the state who speaks with the federal government that by mid-April that should start to flow a little bit more strongly, and Johnson & Johnson should become more available to order for us providers. So we are hoping that mid to late April, we really start to run more at full capacity in Skagit County for each week's vaccinations.
Okay, I want to come back to you on the vaccines availability, but I want to turn to Mayor Gere regarding the small business grant. What did you do through the CARES Act money to develop your small business grant program, and do you anticipate doing something similar with the allocation you get with the
for the CARES grant? For small businesses, we were able to give out $400,000 in actual grant money to small businesses, and up to 25 businesses we were able to give actual funds to keep the doors open. I think that partnered with the payroll protection program are the key things that kept the downtown restaurants and some of our smaller businesses, allowed them to keep key employees and stay in business. Also, we're able to provide and buy 11 parklets or streeteries. We put them on the street. We were able to provide those for our restaurants and some of our retail shops. They then were able to buy with grant money heaters, and we had dining opportunities in the winter in January outside. But you know what? Our restaurants are now, I just left downtown and they're at 50% capacity, and they made it through the winter. And most of them are able to keep their key employees. And that was essential. I don't think some of the doors would not be open today without those two things happening, the CARES and PPP. So really key to our.
Are you gonna fine tune it a little bit with ARP money, given that businesses have survived? Some businesses have survived. Are you looking at using the ARP money for small business?
Other needs they still have. In fact, my planning director just put out another application opportunity. We just want them to continue to be able to make their rental payments, pay their employees as they ramp back up. So we'll continue to provide all that support. Just utilities alone. We have many businesses and individual in the community that are in arrears on their utilities, and we help them get caught up.
And just on that point, really, I think critical for folks to hear that this is a direct correlation to the pandemic, right?
Yeah.
Maybe none of those people got COVID-19, but all of them were impacted by COVID-19.
And in the same hand, they were impacted, and then the city was impacted because the restaurant sector was our four sales tax producer, or sometimes number 2 and number 1, depending on the season. And that kind of went away last year. So if they do well, then the city will do well. And, you know, it's cyclical. So.
Yeah, okay. I just gonna do another PSA here, a reminder to folks that the rescue plan did include another round of economic impact payments. And according to the IRS, the EIPs will continue to roll out in batches in the coming weeks. A lot of people have received them, but in my office, we are hearing from folks who have not yet received their EIP. We're asking folks just to be patient, but if you haven't received it, if you're eligible to receive a payment and you have not received a direct deposit, it still may be coming by paper check, or like the $600 check came to my mom in the form of a debit card. And so it could be a check or a debit card. So just to check your status, you go to irs.gov and use the Get My Payment tool and just ask for some information. And the irs.gov is a legitimate site, so you can use it and put your information there to get info on your payment. Holly, we've got 2 vaccines. They're both the double shot, right? The Pfizer and Moderna. I got the Pfizer one. I know people got Moderna, and now some people are starting to get the single shot Johnson & Johnson. Are you guys administering the Johnson & Johnson vaccine yet?
We will be happy to administer Johnson & Johnson when we're able to get an allocation of Johnson & Johnson. Our fairground site has by and large been a Pfizer provider recently. This week we had Moderna. Early days we had Moderna, so we try to remain flexible. We anticipate the fair is probably likely to stay a Pfizer provider, but that we will try to receive Johnson & Johnson for some of our mobile clinic efforts, just because that allows us to do more, because we don't have to shut down to go back and return to sites to do dose 2, so it's a little more flexible for mobile efforts.
Are there other vaccination partners in the county who have used the J&J vaccine?
Yeah, I think CMAR has had J&J. I want to, it's possible Island Hospital had J&J 1 week. Yeah. Yes, we have had some J&J. Early, when J&J was first released, the state received about, I believe, 80,000 doses of it. So that was distributed around, and then we've just had a bit of a gap until we get J&J again. And this week we should have a little bit more coming into the county, and then we should see that start to increase in mid to late April.
Okay, okay. Laurie, as the mayor, what can we do better at the federal government level? I mean, this is the shortest question with the shortest answer ever.
No, I thought about that earlier today, and I thought, given the circumstances, I think the federal government does an amazing job. I mean, you know,
there's recording this.
Yeah, no, truly, the amount of money that we've been able to access in our community, individuals and our businesses. Yes, there's been some hiccups. I've heard from some of my small business folks, SBA is a little difficult to navigate, but local banks have partnered with them, and overall, great. And get us more, you know, I'd say keep rolling the vaccines coming this way. I think that's the, I think at the local, state, regional, federal level, I think we've worked better together during this COVID than I've ever experienced. Really reaching out, really being a community. You know, I know that locally, our mayors, we meet weekly with the health department, and we try to do things in lockstep. And I know you've come to our town several times in the last few months, checked in, you know, downtown, how's it going? What's, you know, what can we do next? So I really have, I'm amazed how well we've done, and just keep the vaccines. Vaccines were a little frustrating in the beginning,
yeah,
but need to be rolling now. And I also do a shout out to the Samish tribe. They have with the city, trying to get our city workers with their extra vaccines. They're very generous. And I know that's directly from the federal government, the tribes are.
Yeah.
So both our tribal entities in this region have been a great source of help. So.
Yeah, yeah. You know, last year when the pandemic hit, right in March, and then April came, it was the Tulip Festival. And I tell you, the first step, you know, March 13th through April 1st was just heartbreaking time because the Tulip Festival, it's internet, globally known, if not known throughout the universe. And second, it was canceled altogether. And it just, the timing was the worst timing ever. Now, the Tulip Festival is going to happen starting April 1st. And Polly, can you talk a little bit about how the guidance you're giving on attendance and activities from a public health, county health perspective?
Yeah, I think that the people providing services at Tulip Festival have been in good communication with our environmental health team, who really is leading that effort on employer guidance and business guidance for safe operations during COVID. Back in the fall, the governor did allow for agritourism, which helped us in the fall, and it's going to help us again during Tulip Festival. Being open in phase 3 will allow for some additional business activities during Tulip Festival. So I think the organizers of Tulip Festival have been planning. They're in tune with environmental health, with understanding what can be offered to people and how we can make this a really successful and yet also a safe event for Skagit County.
Yeah. So we can look forward to massive slowdowns northbound I-5 once again.
I'm already seeing some traffic.
And you know, Laurie, Anacortes is a great town for a lot of reasons, including tourism. What's the thinking on the both the farmers markets, the weekly farmers markets, as well as the arts festival?
Farmers markets have navigated this really well. They went to a COVID safe model. And I know that going into this spring, they'll work with the health department and provide a safe model, just like all the businesses are. I know the festivals are arts festival is very hopeful, kind of waiting till June 1 to decide if they really can do an event and how it has to adapt to be COVID safe.
Mm-hmm.
I have ordered fireworks for 4th of July. I don't know if we have to block access to the beaches, if people have to do it remotely from their cars, but we weren't going to go another season with at least having fireworks for 4th of July. We don't know if we can have a parade, but we're going to have something. And I think that's been the hardest thing for our communities, those community events that bring us together. From 4th of July to an arts festival, it's our Tulip Festival. It is our once a year community celebration where we bring the arts to the community, we fill up our hotels and our restaurants, and it's just an incredible time. So we're very hopeful we can bring a COVID safe festival to town this year. So, and the same with the Oyster Run, we told them that we'll wait and see on that.
Which one?
The Oyster Run. That's when the motorcycles roll into town, and we've said, we've got your application, but it's a little early to make any kind of plans. So this is our hopeful year.
All right. All right. I'm just going to wrap up with a few comments. One is, I think, Laurie, you said this, vaccinations.
Yes.
If it's your turn, people, get vaccinated. The more people that are vaccinated, the sooner that normal, whatever it was, and whatever we can make the new normal, the sooner we can get there. And we can have an arts festival that brings people together, and more people attend the Tulip Festival. The motorcycle riders at Oyster Run can have a great time. But you but vaccinations are really key. So when it's your turn, take your turn. The second thing I'd say is that we're, at least in Congress, we did the American Rescue Plan. We're pivoting a little bit now to recovery. And I'm on the Transportation Committee. We had a hearing on Thursday with Secretary Peter Buttigieg to talk about that recovery, including the role that investing in transportation and infrastructure can, what it can mean. And I think we need an FDR-like investment in our infrastructure in this country, and do it differently than we've done in the past. Do it so that we can help turn a corner to make a cleaner and greener transportation system and infrastructure investment. So I'll be working towards that, and that's kind of, you know, we're trying to show a little bit of normalcy here, trying to show that we are getting back to work. It's not just about COVID-19, although it is about COVID-19. It's about getting on to the next things too. So I want to assure people that is occurring. But Polly, any last notes? I want to commend Skagit County on the role in this, and really reaching out to the migrant farm community. That's very important. The role of equity in vaccine distribution is very critical. We need to do what we can to fill those gaps. Polly, anything you want to add?
Yeah, I just want to say thank you everyone in Skagit County for working to be COVID safe while we get through to the end of this pandemic. Keep doing all those good things you know how to do while we get through to the end, while you're getting vaccinated. Keep masking, keep distancing, keep each other safe, appreciate each other, but keep each other safe too, and get vaccine as soon as you can.
Great, thanks. Mayor Gere, any last word?
Wear your mask. You know, but yeah, stay safe. Take care of your family, your friends, your businesses, because we are recovering. Well, let's do this together and get there. And yeah.
Well, thanks for the both of you for attending. We're going to be doing another little later today with Island County Commissioner Janet St. Clair, and
Nice.
talk a little bit about Island County as well. So thank you all very much. I'll just end by reiterating what you heard. Wear your mask and stay healthy. We are there. The light is at the end of the tunnel. It's a lot closer than it was even a month ago. But the tunnel's still long, and we're still working through it. But we are, you know, it's positive, and we're getting there. But let's keep it up. So thank you all. Thank you both. Appreciate it.
Thank you.
Appreciate you. Thanks what you do.
Thanks.
Bye.